So I'll come back to that. We're getting a lot of interest, a lot of questions. So my first question is to Dr. Pratik Choudhary. We heard that type 1 diabetes is an autoimmune disorder. Some of the viewers would like to know if there's a genetic component, and also could you also briefly touch upon diabetes, type 1 diabetes and impotence? Dr. Choudhary.
Thank you. This is a very common question, is type genetic? But actually, less than 10% people with type 1 diabetes, any other person with type 1 diabetes in their family. So most people will be the only person in their family who have type 1 diabetes. Whereas with type 2 diabetes, actually, it's, we all know it's so common in the families. So the genetic part of type 1 diabetes is that you have a higher risk. You have certain genes that put you at a higher risk. But if you have that gene, it doesn't mean that you're going to get type 1 diabetes. You can't predict when people, a lot of mothers are scared, will my child have type 1 diabetes? So the risk is about just less than 1 in 10. So if you have type 1 diabetes, for your child to get it, less than 1 in 10, and that could happen at any time in their life. So not when they're young, it could be when they're 5, 10. We're seeing an increase in type 1 diabetes diagnosed in the ages of 20 to 30, 35 even. While there's genetic, I think a lot of it is random chance. Type 2 diabetes is much more genetically or family driven. If your parents have type 2 diabetes, you've got a very high risk of getting it. And the second point, Dr. Sushil, you asked me to cover is around impotency. And I think that's to the talk of separating the mental part and the emotional part with the diabetes. Because yes, of course, if you've had long-standing type 1 diabetes and have struggled to maintain the control, impotency is one of the long-term conditions. But actually, if you think about it, the mental side comes in much earlier, because if you don't have any of the other complications of type 1 diabetes, your feet are okay, you can feel things okay. And if someone is struggling with these sort of issues, it's probably more to do with the diabetes distress, the depression, the psychological impact of diabetes and how it affects them. And I think that is where becoming oneself, calming down, using mindfulness to could be helpful, because there is this in between the physical and the mental health. So I hope that answers the question.